I'm Von Biggs, and let's queer up health. New study says U.S. healthcare must address poverty, violence, and health together. A new study published on U.S. healthcare disparities argues that poverty, violence, and poor physical and mental health should be treated as interconnected public health crises rather than separate conditions. Researchers say traditional healthcare systems are often organized around isolated diseases and are not equipped to address what experts call syndemic overlapping health conditions intensified by social inequality and structural disadvantage. The report highlights how housing instability, food insecurity, limited healthcare access, and exposure to violence can increase risks for depression, PTSD, chronic illness, and early death. Marginalized communities, including LGBTQ+ community and Black and Hispanic populations, are disproportionately affected. According to the paper, more than 37 million Americans live below the federal poverty line, while firearm violence remains a leading cause of death among young people, especially in urban communities. The author argues that many healthcare systems now screen patients for social needs or trauma exposure, but often lack the infrastructure, funding, or partnerships needed to respond effectively. The study also points to long-standing mistrust of healthcare systems among marginalized groups, including queer community. This mistrust is rooted in historical abuses. Researchers are calling for, quote, a syndemic-informed, end quote, healthcare approach that integrates behavioral health, trauma-informed care, and social services. Recommendations include expanding community partnerships, embedding care navigators in healthcare teams, improving preventive care access, and training providers in structural and cultural competency. The authors conclude that achieving health equity will require healthcare systems to move beyond treating individual illnesses and instead address the social conditions driving disease and inequality. So this is a lot. There's a lot in this study, but I actually did a talk not too long ago at FAU where we were talking about social determinants of health, which, a lot of hospital systems, we screen for that. We screen for poverty. We screen for people needing food access, for health and things like that. But what this is really addressing is a syndemic approach, which we're now seeing that word used a lot. We just recently went to Chicago to for the conference that Francesca and I had went to, and it was about syndemic approaches where you're looking at multiple issues that are causing. And if you start overlapping those social determinants of health with healthcare, the problem is our systems aren't designed to handle that. They're designed to come in, oh, you have a problem, here's your problem, we'll treat this with your pills, but they're not addressing everything else that could be causing that. And there's a lot in this, because there is, but that's the overall arching theme of it, is our healthcare systems need to do better. We need to be looking at how to take care of the whole person, not half of the person, because if you're only looking at one part, you're not seeing the whole person.
Wow. Yeah. Great point. Well, this study is groundbreaking.
Yeah.
It's a groundbreaking discovery. People can't heal properly when they're broke, traumatized, hungry, and scared. Wow. Next, scientists will announce that water's wet. But seriously, healthcare without humanity is just paperwork with fluorescent lighting. That's it. I mean, you've got to treat the whole person, like you said. And most places are just not structured or even want to help the whole person.
Right.
Well, I wanted to start at a base number that you said 37 million people are in poverty. Okay, that's like 1 in 10 people.
Right.
That means statistically, someone in this building right now lives below the poverty level. And I don't have a number in front of me, but it wouldn't take a lot of work to find that that's a low number. And that people with mental health issues, that number is going to be even higher.
Right.
Because mental health, while poverty can be a cause of it, but mental health doesn't know your socioeconomic background.
At all. There are people from well-to-do families out there on the streets and are homeless in Miami. Go to the Skid Row, you'll see it.
Yeah.
It's unfortunate.
So, but I mean, remember, we've got a majority in our government still that doesn't want to even acknowledge that there's a healthcare issue. And if they can just treat the one and get you out the door, then they're fine with that.
Right.
So yeah, it's wanton neglect.
Yeah. We just have to keep asking for more. As consumers, as people in healthcare systems, we need to demand more. That's the call to action there. It's for us to do that.
And we are demanding, so we
Yep.
can do that for sure. Well, folks, there is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.